Hi, everyone, and welcome to the second episode of Exploring the Invisible. My name is Rebecca Nadler, and I am the founder of the Invizibles organization. I was diagnosed with mast cell activation syndrome and some of its comorbidities over 5 years ago, and I decided to start this foundation to help raise awareness for people who suffer from invisible illnesses like myself. For our second installment of Exploring the Invisible, I spoke to Sneha, the founder of the Health Advocacy Summit and the Crohn's and Colitis Young Adults Network. Over 133 million people in the US are affected by at least one chronic illness, and Sneha hopes that the Health Advocacy Summit will provide a community and much needed resources for young adults with chronic conditions that are learning how to advocate for themselves. I would love if you could introduce yourself to the Invisibles.
Yeah. Hi, everyone. My name is Sneha, and I am 22 years old. I live in Indiana. I just graduated from Indiana University in May of 2020, and I have been part of the chronic illness community since I was a little under 6 years old.
If you don't mind sharing what were you diagnosed with and what kind of impact has that had on your life?
Yeah, definitely. So I was diagnosed with ulcerative colitis, which is a chronic inflammatory bowel disease. It's very similar to Crohn's disease. Most people have heard of Crohn's. When I was 6 years old, and throughout elementary school, I was not super sick, but I was put on a lot of different steroids, a lot of different treatments to try to keep me as healthy as possible. And I, of course, had to do a lot of like the nutritional drinks and everything, because when you're diagnosed at such a young age, it really can impact your growth and your nutrition long term. But it wasn't until middle school when I got really sick. So I had probably the biggest flare up that I had. Well, not probably, definitely had the biggest flare up I had since I was 6. And so in 6th grade, I started getting a lot more symptoms. I would use the restroom upwards of 20 times a day. I did partial schooling, so I wouldn't go to school super often. In fact, I probably just went a few times a week. And even the few times a week that I did go, it was probably just for like an hour or 2 hours before I would have to come home due to an accident or due to just intense amounts of fatigue. And so I kind of lived that way for about from 6th grade to 8th grade. And during that time, I also had a PICC line, and I was like going to all these different centers to try to, find treatment. I tried alternative therapy. I went to California for, I think, a month to try to heal naturally. That did not work. So I had the colectomy surgery, which is the removal of the entire large intestine, my freshman year of high school. So up until then, I was, really getting down to the last bits that I could probably, wait until getting the colectomy surgery. And so I would go to the hospital at least once a week. I weighed a little under 60 pounds. And then I had my colectomy surgery, I think the middle of my freshman year of high school. And since then, I've had, I think, about 3 or 4 major surgeries. And so I had the ostomy bag, which is when a piece of your intestine sticks out, and that's where you use the restroom from. And then I now can use the restroom normally. I have a J pouch. And so that's basically when your small intestine is built into the shape of a J. And I can use the restroom, quote unquote, normally. And I still have quite a few challenges because I think, before the colectomy, they sort of phrased the colectomy surgery as a cure for ulcerative colitis, but it's very much not the case. In fact, now I have a new condition called antibiotic refractory pouchitis, which is technically classified as a rare disease. So I get specialty treatment in New York City for that, because they don't have specialty centers in Indiana. So I'm still sort of trying to find the best treatment option, but relative to middle school and high school, I'm significantly better, which I'm thankful for.
Okay. So clearly it had a big impact on your academic life. So how were you able to cope with that, as well as the impact I'm sure it had on your social life?
Yeah, those are great questions. So I think academically it was very hard, but I think that I was very lucky that I had great accommodations in high school, and I had very flexible accommodations in high school. So it wasn't like, I would have to turn in something at a certain date, I had a lot more flexibility, I think, than a lot of other people do, or what I've heard that a lot of people other have. So I think that was really paramount into ensuring that I was able to still, perform academically, but also, do so at a pace that wasn't extremely stressful. However, I will say that the way that I found out that I could have an S504 plan was in a way that I don't think anyone should have to figure it out. I was almost suspended before I realized that there were actually laws to protect me from, if I had to miss like weeks of school, then I would be protected under the Rehabilitation Act. So I think that, initially it was very challenging, but as soon as I did get the 504 plan, it made my life a lot easier. In college, it's a completely different story, I think, because there's so many different systems that you have to navigate, especially if you go to a big public school. It can definitely be a lot more challenging to try to find and really advocate for yourself in a system that is not designed for chronic illness and more cyclical conditions. And so with that, it was a lot of, I think, I had to, as well as a lot of my peers had to overcompensate for, missing class and having to navigate such a system. So I think academically it was very challenging, and I learned a lot about different ways that we can advocate for our peers, because so much needs to change, I think, in the education space, and particularly in higher education. There's a disproportionate number of students with chronic conditions that don't pursue higher education because of a variety of reasons, but I think very strongly because the systems were not designed in a way to empower us to pursue education. And then socially, I think that was probably the biggest challenge, and something that it took years of effort and conscious effort on my part, because from middle school to high school, I was in a period of isolation. So I really didn't have any friends, except one of my good friends who he passed away with Crohn's disease, but he was really the only person that I knew with a chronic illness that was my age. But besides that, I really just hung out with my mom for about 5 years. So I didn't have that social interaction, and I didn't really know how to make friends or develop social bonds. And so that, I think, in college was something I had to learn. And even throughout high school was something that I had to learn when I had missed out on so much development and so much growth, and having to sort of readjust to peers who were not maybe having to worry about bigger things. They probably had their own things to worry about, but I think having a chronic condition, I think, makes you mature so much faster and makes you have to figure out things that your peers probably wouldn't think you would have to. So.
Definitely, it's almost an entirely different perspective to look at things from, and it definitely makes you value health from a much younger age.
Absolutely. And it makes you, have to advocate for yourself at such a young age. I mean, you can have all the parental support in the world, but it's like at a certain point, it's you that has to start speaking up for yourself, which I think is a great skill to develop for anyone. But I think we as young people with chronic conditions have to develop it at a much younger age too. So.
Switching gears a little bit, I was wondering what inspired you to start getting involved with patient advocacy.
Yeah, so this is really interesting because my patient advocacy journey is very, very all over the place, but I'll try to keep it pretty succinct. So I realized that there was not enough support for adolescents and young adults with chronic illnesses. So a lot of organizations, foundations, medical systems focus on kids and focus on adults, but there's nothing for this in between, which is probably one of the most critical periods of learning independence and learning a bunch of resilience and different sorts of skills. There's a lot of neurobiological changes that happen during adolescence and young adulthood, and to not have support and to not have resources is a huge gap, especially because a lot of us are being diagnosed with chronic conditions at younger ages. And so I realized that there was this huge gap in terms of resources and support for an age demographic that is arguably one of the most important demographics to target. And so I brought together about 14 young adults in Indiana in October 2017, and I did this because I was also very concerned about what my future would look like. So I was thinking about how I would navigate college, how I would navigate the workplace, what my future would look like with a chronic illness in it. And so I brought together about 14 young adults, in Indiana in October 2017, and we discussed a variety of topics from navigating the education system to navigating the workplace to health policy. So we had a health lobbyist that came and spoke to us, and then we also had I can't remember if I said mental health, but that was also something that we talked about, and it was really interesting because in Indiana, access to mental health might look very different than access to mental health in some bigger hospital centers where you have a lot of different care coordination. And so for many of us, we didn't ever formally seek, a therapy or some sort of, we never really had coping resources that were prescribed to us sort of in the medical system. And so this was a really interesting session that we had at our first summit. And then we developed a website, and we got inquiries from other parts of the nation. And I think that we also targeted some certain areas too that we could develop a similar model, because I think the first year was really successful in showing us how many resources we need and how much of a community our demographic could benefit from. And so we expanded to North Carolina in conjunction with Duke University, and then South Texas in conjunction with the University of Texas at Rio Grande Valley. So we were in South Texas, which was also very interesting, of course. And then we expanded to San Francisco in 2019. And then in 2020, we were supposed to be in 6 different states. Of course, that all got canceled because of the pandemic. But I think the pandemic really allowed us to think more bigger about how we could support our demographic and really think about ways that we can not only provide year-long support, but also start developing more advocacy arms so that we can advocate for our demographic in higher education or in the workplace or in specific areas that haven't really been touched before.
Yeah. Got it. I will say, I attended the virtual health advocacy summit over the summer, and I thought you all did a wonderful job, and it was truly informative, and I definitely felt that sense of community. So I want to applaud you for that.
Thank you so much for attending. I'm so glad. We're planning our next one in August of 2021 as well. So we learned a lot from the first virtual summit, because I mean, virtual summit planning is so much different than in-person summit planning. I mean, it's polar opposite. So we're excited to do another one this August, and hopefully keep this even after the pandemic, because we don't have the capacity to hold a summit in each community. But I think if we have like one summit every single year, we can connect people from all over the world into one event. I think there's a lot of value to having these in-person connections, because we are going in communities where resources haven't really trickled down. So for example, Indiana, South Texas, but and to facilitate that in-person connection, has its own value too. So we're definitely excited for a post-pandemic world where we can start doing our in-person summits again.
Definitely. So I do have another question. I was wondering why you decided to start both the Health Advocacy Summit and the Crohn's and Colitis Youth Action Network, and how the two work together.
I'll go back a little bit to share how the two work together. So after my first major surgery, the colectomy surgery in high school, I felt very similar feelings to how I did when I started the Health Advocacy Summit. So there's Camp Oasis with the Crohn's and Colitis Foundation, which is an incredible week-long camp for kids with inflammatory bowel diseases. But that's where the support really ended. And that's also, another thing, that it was for kids. It wasn't for young adults. And so I was really trying to find something that a way to connect with other young adults, specifically with inflammatory bowel diseases at that time, since I just had my first major surgery. And so the way that I did this in conjunction with my late best friend, Corey Lane, who passed away with Crohn's disease and osteosarcoma, we created the Crohn's and Colitis Teen Times, which turned into the Crohn's and Colitis Young Adults Network. But the Crohn's and Colitis Teen Times was a newsletter that we distributed within Indiana. just to find other young adults and try to provide some sort of relatability, because at that time, blogs, I don't think were super popular and newsletters were not super popular, but we were actually like printing out newsletters for young adults with inflammatory bowel diseases. And in the newsletters, we had everything from interviews with local doctors to tips on like what to eat before you have a major surgery, or just, you know, little things. They were fun, some were more serious, but it was a really fun way to find more young adults with IBD in Indiana. But then we built a website, and then we, similar to Health Advocacy Summit, we started getting more traction from around the US and really around the world too. And I realized that not all the people who were looking at our newsletters were young adults with IBD. It also was young adults with other sort of chronic conditions, and that's kind of how the Health Advocacy Summit came about more so. But when I went to college, I started working more so on the Health Advocacy Summit and not as much on the Crohn's and Colitis Teen Times. I think partially because newsletters were becoming more popular, people were finding online connection through social media. So I think the value of our newsletters maybe went down a little bit versus like 4 years ago. And I wanted to make sure that we were doing stuff that was really directly impacting our demographic, especially because everything we do takes a lot of time. So if it's not really impacting our demographic as much, maybe there's other ways that we can, innovate to ensure that we are reaching the most young adults and the littlest time and effort it takes, if that makes sense. And so I was thinking about it, and my freshman year of college, I rebranded the Crohn's and Colitis Teen Times into the Crohn's and Colitis Young Adults Network, which facilitates an international fellowship program for young adults with inflammatory bowel diseases specifically. So this was a way that I thought that we could train a specific cohort of young adults and really have them be the ones to facilitate outreach to their communities of young adults with inflammatory bowel diseases. And part of the reason that this also came about was that I've had a lot of opportunities to attend various conferences. And what was always frustrating to me was that there were not enough people my age at these conferences, whereas I think that's one of the most important demographics to include. I mean, I should not be the only 20-year-old at these major conferences that are happening, because we need to start planning for our generation. And so part of the fellowship program includes a opportunity to attend a US-based conference, and we fly all of our fellows to a US-based inflammatory bowel disease conference. And so we just finished our second year basically of the fellowship program, and we had 8 fellows, 5 from the US, 1 from India, and 1 from the UK. And they produced monthly content for the website. They heard from monthly speakers on a variety of topics, from drug pricing to the latest research in IBD to social media advocacy. So quite a holistic lens of advocacy. And then they also, of course, we were supposed to fly them to a US-based IBD conference. That didn't happen, but we instead we partnered with Advances in Inflammatory Bowel Diseases for our fellows to get to still have that conference experience and disseminate content about the latest research findings to other young adults with IBD who are not part of the fellowship program. And so we just selected our fellows for our 3rd year of the fellowship program. We have fellows from the US, Canada, Greece, Malaysia, and India. So we've grown quite a bit. And it is a pretty solid application process too, just because we do provide unique opportunities, and we also provide a stipend. We aren't able to accommodate everyone who applies, but we have started to think about other ways that we can provide support to young adults with IBD who necessarily weren't selected for the fellowship program or who want to be part of other opportunities. So the way the Crohn's and Colitis Young Adults Network is through the Health Advocacy Summit, to get to your original question, was the Crohn's and Colitis Young Adults Network has sort of become a program through the Health Advocacy Summit. And they're almost like 2 separate organizations, but they're together because it's hard to be running 2 nonprofits separately and the logistics behind that. So they're together, and we have 2 different staff members who sort of one works on the Crohn's and Colitis Young Adults Network, one works on the Health Advocacy Summit separately. So, yeah.
Got it. Okay. And speaking of both of them, what kind of impact do you hope they have in a larger sense?
Yeah, so that's a great question. So I think that because there has really been nothing, I shouldn't say nothing done, but there hasn't been a whole lot for our demographic. I think
Mhm.
I would love to see us starting to develop not only more communities for support, but also more advocacy within specific sectors. So, for
Mhm.
example, higher education, I've talked about that a little bit, but I think that there's such a huge gap in higher education. And it's bizarre to me that there hasn't been advocacy for young adults with chronic conditions, because chronic
Mhm.
conditions, you could arguably say, have different needs and different accommodations than necessarily putting them under the umbrella disability. And so there's a lack of education at a systematic, at an administrative level of what chronic conditions need in higher education. And so that's, an area that we'd love to work on a little bit more and be that voice in an area that hasn't been tapped into. But also things like navigating the workplace and navigating
Mhm.
financial resources. So supplemental security income, for example, is a great option for our community, but a lot of people don't know about it. And it's a lot more confusing for people with chronic conditions. I mean, the SSI system just doesn't really work for chronic conditions, rather than disability as a whole. And so there's a lot of avenues I think we want to go, because we are covering such a large demographic, but we are trying to focus in on a few that we can tangibly do within the next couple of years or so.
Yeah. And you sort of briefly touched on it there for a second. I was wondering, I think there definitely is a blurry line between, chronic conditions and disability, and I was wondering, like, how you envision that.
Yeah, so I was actually thinking about this a couple of days ago. So I think it's so difficult because within the, I personally didn't identify as having a disability until my freshman year of college. I didn't know
Mhm.
that having ulcerative colitis was counted as a disability,
Right.
and I think that's a
Mhm.
huge problem. And I think our conversations, um, at least in the disability community, have not been fully inclusive of chronic illness, and I really do think that is starting to change. But
Mhm.
I think chronic conditions are very unique in that they might not impact someone all the 100% of the time.
Mhm.
So like, for example, me, I could be without a flare for a couple years, but in the next few years I could be, have a huge flare up, or whatever. And so I think there's a pretty blurry line there, as you said,
Mhm.
and I think that there needs to be a lot more inclusion of people with chronic illnesses within the disability space. And I do feel very optimistic that the disability community is starting to recognize that a
Mhm.
lot more. I mean, I'm on the board of Respectability, which is an awesome organization that does work for disability in Hollywood, and in the workplace, and fighting stigmas in the workplace. And they seem to also be really interested in chronic illness and including that more as under the definition of disability too. So.
That's awesome. Um, so I was wondering, something that I found really interesting is that you are part of the Disability Policy Committee for
Yeah.
the Democratic National Committee, and I was wondering, what kind of work you've been doing with that.
Yeah, definitely. So I maybe I'll back it up a little bit too with how I got involved with that. So I in Indiana, so I've been involved with politics for a few years now. And this is separate from my work at the Health Advocacy Summit, because
Mhm.
Health Advocacy Summit is a 501(c)3. We don't really do any sort of we don't do any political advocacy, but
Mhm.
I first started in politics when I interned for my congressman in high school, and um, it was a very interesting experience, to say the least. But I didn't really have a lot of policy education, especially growing up. My parents, none of them were really ever involved with politics. Didn't really Were a little bit more apathetic toward politics, and
Mhm.
I think that that's changed a lot in the last few years, definitely. But I started researching on my own, and I was like, okay, so there's so many different policies that we don't know about,
Mhm.
that directly affect us. And I think that's a problem,
Right.
that there's very little policy education, and specifically health policy education. So I started getting involved, especially in college. And also, I should say, Bloomington, Indiana is a very small town, but it
Mhm.
is so politically active, and the connections that Bloomington, Indiana has to Washington, D.C. are unreal. I mean, yeah, it's kind of crazy how like such a small town in Indiana is so
Mhm.
politically connected to like DC and national politics. And so I got involved there, and I attended a couple of city council meetings, and I attended those because I was a journalism major. That was one of my majors, so I had to do a lot of like writing and, of course, journalism major, duh. But I attended a city council meeting, and they started calling out the different caucuses that existed for the 9th district, which is where I live in Indiana, 9th congressional district. And so they were calling out like a labor caucus, women's caucus, a black caucus, and I think a couple other ones I can't remember, but there was no disability and there was nothing specifically related to health. And so I was kind of shocked about that, because I mean, disability encompasses all forms of diversity and is arguably one of the most under talked about groups when discussing diversity. And so I was like, okay, how do I start one? Because I would love for there to be voter guides. I'd love there to be more inclusion of us in politics. Because I mean, we'd bring so much value if we were able to sit on different boards of like local government and everything like that. And so I created the 9th District Disability Caucus, which was the first disability caucus and still only disability caucus in Indiana, with the Democratic Party. And it sort of transitioned from there. I started becoming more involved in politics and policy. And I haven't been involved with the DNC Disability Council a lot in the past few months, because of course things have wound down a little bit, but I was a part of developing primers for some of the candidates for 2020, the 2020 candidates. So that looked like from a variety of topics, from education to supplemental security income, to a variety of other primers for candidates. And then I also spoke at the DNC, the convention. I spoke about disability issues, and specifically was so excited that they included me because I was talking more so about the chronic illness perspective. So, yeah.
That's awesome. So I was wondering, do you have larger political aspirations?
I would say no.
Okay.
I think if you would have asked me that 4 years ago, I'd probably been like, yes, of course. But I think that there's so many other ways that you can make an impact, and I don't think that politics are always the way to go. And I think I'm really interested in health policy from like the pharmaceutical perspective and like the insurance perspective. So I think there's a lot of issues with drug pricing, and it's like a lot of issues that I see with working with young adults with chronic conditions for 4 years that I feel like are just going under the rug. And I don't think that necessarily holding a political position will probably be the best way that I can go about making those changes. But that's not to say I have completely ruled it out, but I definitely think at least for the next decade I have. But I actually held a political office. It's kind of funny because it's like the lowest political office that you could be elected to, but it's called a precinct position. So I was a precinct chair for my like little district within our congressional district. And so that was kind of cool. But beyond that, I don't necessarily foresee, because it's a lot of work. I mean, I have so many friends who've worked on campaigns, and like it is a 24/7 job. So
okay. So do you have any advice for other young adults that want to get involved with this kind of advocacy work?
What I will say is that I think there's so many different communities that need more support and that need more empowerment. And I think finding specific areas that you want to work in is the first way to start out. And I always say that you don't need a huge plan to start out any sort of advocacy. You can just start tomorrow. I mean, I planned a little bit in the middle of when I was doing Health Advocacy Summit and CCYA, but I never fully like made a plan. And I think that was part of why we were able to grow to the extent that we did, because we never I think having a baseline plan is good. I'm not saying like just start doing things, which I still do sometimes, but I also feel like, just starting the next day, starting tomorrow, starting today is a great way to just at least get your foot in the door in advocacy, because there's so much you have to learn. And there's so much that I'm learning. And so I think it's really powerful to just get started. And yeah, you don't have to wait a month or a year. And you don't have to start an organization. That by no means is a prerequisite to getting involved in advocacy. I think supporting other organizations that exist is a great way to go, and one that I think is very, very important, because there are lots of great organizations out there. But of course, if you don't see something in your space, I think that's perfectly great and awesome to start something of your own. It takes a lot of effort, though. I can't say that enough, because it's like you create something, but then you have to keep it sustainable, and then you have to be able to hire people. So it's quite a process. And I think that is often discounted within the nonprofit world, is how much it actually takes to build something up and keep it growing. Because a nonprofit, after all, is sort of a business in a lot of ways, and that you have to, have an accountant, you have to have a legal team, you have to make sure that like you're doing all the salaries correctly and everything. So
and it's really interesting that you say that, because I think that's sort of how I got started with the Invisibles. It was something I was diagnosed right before I started freshman year of high school, and it was something I've been thinking about since then, essentially. And with the pandemic and being home, I sort of just decided to get started this past summer. So I'm very excited I did.
Yeah, no, that's incredible. And yet, I mean, yeah, you're a perfect example. It's like just taking that first step, because you're going to learn so much after that first step, or after the next few steps, that you just can't plan for. And so I think just getting started is so important. And I mean, that's incredible that you've been able to do that since the summer. It's really awesome.
Thank you. So I was wondering, do you have any future plans for advocacy work?
Yeah, so if you follow me on Twitter, which you don't have to, or if you have followed me, I haven't historically been active on social media, just because I haven't had a lot of time. But I just recently started getting involved. But if you have followed me for some time, then you know that I'm really, really passionate about drug pricing. I've worked a lot with pharmaceutical companies, both on, well, I shouldn't say a lot. I've worked with pharmaceutical companies both on their advisory boards, and also as marketing consultant. And then I also interned at a major pharmaceutical company in their health economics department. I don't know if it's called department, but it was for their inflammation and immunology for their health economics. And it was so enlightening as to what goes behind the scenes. And I think it's really frustrating for me, because I do all this work with Health Advocacy Summit. I see the challenges that a lot of our demographic is facing in terms of financial challenges, especially. And it's frustrating to see these big forces against a demographic that really needs support and is really gaining independence for the first time. And so I think that I'm really interested in health policy from that perspective. So I'm kind of considering that, but I haven't decided yet, because I am really passionate about Health Advocacy Summit and working on it at least for the next couple of years.
Okay. That's awesome. And it's something that I've seen in the news a little bit, with EpiPens and insulin price gouging, and beyond that, I haven't seen much in major news outlets. I've more so seen it on social media from smaller communities, and I think it's great trying to bring more awareness to that and advocating for that.
Yeah, absolutely. I mean, there's so many great organizations that are fighting aggressively against pharmaceutical companies like IMAC. They focus on the over patenting that pharma does with medications. So, for example, with Humira, it's been on the market for a long time, but it's the price still keeps on going up for it, which makes no sense. And I think everyone's heard about insulin. It's probably one of the most frustrating instances of drug pricing and hyper profits that pharma often has. And that's actually one of the reasons that we don't, as Health Advocacy Summit, we don't work with the pharmaceutical industry, and we have put a really hard line on not receiving funding from them at this moment, because of the way that we see their actions playing out with our community members.
First, please let us know your Twitter so we can follow along.
That's funny. Yeah, it's at Sneha Dave 98. My first name, my last name, 98. I do like post a little bit more about pharma stuff and some really interesting articles on there if you would like to follow along. But yeah, so.
Awesome. And of course, please let us know where we can find you, maybe on Instagram or websites with Health Advocacy Summit and anything else as well.
Yeah, so you can find Health Advocacy Summit at www.healthadvocacysummit.org. It's spelled exactly how you would think it's spelled. It's kind of long. And that's one actually advice I would have is don't come up with a long name for any of your organizations, because it's a lot long term to say, and for people to have to remember the words and everything. So anyway, yeah, www.healthadvocacysummit.org. And then you can find us on Instagram at Health Advocacy Summit, Twitter at HA_summit. And then for the Crohn's and Colitis Young Adults Network, it's CCYAnetwork.org. The Instagram is CCYA Network, and the Twitter is also CCYA Network. And I'm not like super active. I was supposed to be active on Instagram, but I am not super. But if you would like to connect with me, my Instagram is at SnehaDave98. But the best way to reach me is through my email, which you can also find on the website too.
Thank you so much, Sneha, for all of your advice and taking the time to talk to us. We really appreciate it.
Yeah, thank you so much, Rebecca. This was so much fun.